Hello and welcome to your simulation overview for adjunct faculty. Video number 1 will be an introduction to your simulation day and about the newer pre-briefing process we will be using. An overview of your simulation day, you will get a course-specific schedule closer to your Hi-Fi day. The day will run from 0800 to 1500. I do ask that faculty arrive at 0745 and stay approximately 5 minutes afterwards in order to do an evaluation session. Depending on the setup needs for the afternoon session, we will either take a 45-minute or a 1-hour lunch. The healthcare simulation standards of best practice were developed by the International Nursing Association for Clinical Practice and Learning, and ACSL, and were just updated in 2022. I had the opportunity to go to their conference in Milwaukee this year. You will not be responsible for all 10 standards. The ones that you will be responsible for will include pre-briefing, facilitation, the debriefing process, of course, professional integrity, and evaluation of the learning. So what is included in pre-briefing? Pre-briefing includes both preparation activities and briefing activities. It helps to ensure the learner is prepared for the educational content, can help balance cognitive load demands, increases the effectiveness of the simulation, and helps to establish psychological safety within the simulation environment. To be more in line with best practices, we have developed a pre-briefing learning activity here for our students. The students will be given a worksheet to complete with the help of their group. The purpose of the worksheet is to augment the learner's previous knowledge and help correlate it into the simulation activity. We usually give the students between 15 to 30 minutes to work on this sheet, depending on its complexity. We then review the sheet as a group and introduce them to the patient scenario. 495, because it is an introduction to practice, works a little bit differently, but Ms. Talbot is the simulation champion for that course. The pre-briefing activities usually take about an hour. So let's review what your responsibilities will be. Prior to your high fidelity day, I will give you a copy of the pre-briefing activity, complete with answers and reference pages back to their textbooks. So what is your responsibility during pre-briefing? The big thing is be positive and maintain professional integrity and help to promote psychological safety within the lab. Even if simulation is not your favorite thing, please be positive and try to help the students to have a positive and productive day. The other things we will do is answer questions about the pre-briefing activity, and then we will encourage critical thinking about prioritizing their day once they are introduced to their patient. We will help review the worksheet and introduce the scenario. I will be there as well. Other things that we tend to do during this time is like in fundamentals, when they are introduced to the SCD hose, I bring them out and let them play with them before they have to do it during their simulation activity. Both the literature and our own use of the pre-briefing worksheet and activities have provided the students with a much better learning experience in their simulation day. It tends to help them be able to focus on what they need to learn. And so we have made worksheets for each of the different classes. This ends your video number 1 about pre-briefing and the introduction to your day in the Hi-Fi lab. Please email me, and it's in the please email me at retterj@queens.edu with the answer to the following question. The question is, what is my cat's name? My cat's name is Eliza. Again, please email me the following question. What is my cat's name? My cat's name is Eliza. Once I have your email with the answer, I'll give you credit for listening to video number 1. Thank you very much.